Hello students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we are going to deal about fibroid. So fibroid is again a very important congestive pelvic pathology from which questions are asked very frequently in the university MCQ based examination, as well as it is kept as a short case or a long case in the practical examination as well, both undergraduation as well as post-graduation. So because of that reason, I have brought this fibroid topic into two sessions. In first session, we'll be dealing with the entire information which you need to learn about fibroid, and in the second part of the session, we'll be dealing with the investigations as well as the treatment of fibroid. So let's start with the topic. So to begin with, fibroid means it is a benign smooth muscle tumor. We all know that a tumor can be either benign or malignant. Malignant means cancerous, benign means non-cancerous. So it is actually a benign smooth muscle tumor which arises from the myometrium of the uterus. So we all know that uterus has three layers: the endometrium, myometrium and the perimetrium. The endometrium is the uterine cavity, the myometrium is the muscular layer of the uterus, and the perimetrium is the outer surface area of the uterus. So from the myometrium of the uterus, this benign smooth muscle tumor arises. So because of that reason, it is also called as leiomyoma or fibromyoma. So in any question, if you get to see a term called leiomyoma, it means it is a fibroid, right? Okay. This fibroid arises from a single monocyte. Since it is derived from a single monocyte, it is entirely monoclonal in origin. So fibroid is actually monoclonal in origin. It is a benign smooth muscle tumor which arises from the myometrium of the uterus. Is that clear? Okay. And the most important point here is that fibroid is the most common benign solid tumor in women. If you take women into consideration, the most common benign solid tumor which are seen in the women population more commonly is going to be the fibroid. So fibroid is the most common benign solid tumor which is seen in women. In which age group female fibroid is seen most commonly? So around 25 to 30 years. So reproductive age group females who are around the age of 25 to 30 years, in those patients, fibroid occurs more commonly. Is that clear? Okay. Now, this condition, fibroid, is actually a hormone dependent condition because it is an estrogen and progesterone dependent tumor. So this benign tumor is actually an estrogen and progesterone dependent tumor. So we all know that since it is estrogen and progesterone dependent tumor, therefore in all these patients, in all these reproductive age group patients between the age group of 25 to 30 years, these females should have increased level of estrogen and progesterone in their body. Only then this tumor can arise. Because this tumor is an estrogen and progesterone dependent tumor, only when these hormones are increased in those females, then this tumor can actually arise in her. Right. So what are the risk factors? So the risk factor is always hyperestrogenism. What do you mean by hyperestrogenism? That is, the estrogen levels are present in higher concentration in the female. So when does a female will have higher concentration to estrogen? It can either be because of, let's say for example, the mean age for the attainment of menstruation is around 12 years. Right? So right from 10.5 to 12 years. So 10.5, a female will be attaining her puberty. Around 12 to 13 years, a female will be attaining her menstruation. So if the female attains menarche even before this 12 years, even before these years, like let's say for example around 11 years or say 10 years or 9 years, if she attains early, then she is actually exposed, increased exposure to estrogen is present in her, because we all know that whenever menstruation is going to happen in a female, whenever a female is going to attain early menarche, then she will be exposed to the estrogen hormone. Is that clear? Yes. So the mean age is 12 years. But if this female is exposed to this estrogen at around 2 or 3 years earlier, 2 or 3 years earlier to the mean average years, that is 12 years, before 12 years itself, let's say for example 2 years or 3 years before the 12 years itself, the female is exposed to this hormone. So since she is exposed to this hormone 3 years earlier than in every other normal female, therefore she has an increased exposure to estrogen in her lifetime. Similarly, in those females with late menopause, what do you mean by late menopause? In India, around 47 to 51 years is the average time for attainment of menopause. right? Menopause is cessation of menstruation in a female, right? So around 47 to 51 years is the average time for the attainment of menopause. If any female is going to attain this menopause after 51 years, let's say for example a female is attaining menopause by 55 years, then she is actually exposed to this estrogen for an extra period of 4 years, right? Every normal female is going to attain menopause between 47 to 51 years, but if this female is going to attain menopause by 55 years, then extra 4 years she is exposed to this estrogen, because always remember, whenever a female is menstruating, estrogen is present in her, right? Since she is exposed to this estrogen for a longer period of time than every other normal female, therefore hyperestrogenism is present in her. Is that clear? She is exposed to estrogen for a longer period of time when compared to the other normal female. So she has been exposed to this estrogen for extra 4 years. So since she has been exposed to this estrogen for the extra 4 years, she has a risk factor, right? So therefore early menarche, late menopause and late first conception. Why late first conception? So late first conception is because if a female is going to plan her pregnancy late, so therefore every year the female is going to have around 9 to 12 cycles, right? 9 to 12 cycles the female is going to experience. So whenever the female is going to experience cycles, during every menstrual cycle the hormone is going to be present, estrogen and progesterone is going to come into play. So the female is not getting any break from her periods, right? Only if a female gets pregnant, then only the female will get break from this menstruation for around 9 months, 10 months, right? And she'll be breastfeeding for about another year. So like a mean of 2 years the female will be not exposed to menstruation. So once she is not exposed to menstruation, therefore the levels of estrogen will be decreased in her. But if the female is going to plan her conception, that is the first conception, very lately, then she is going to be exposed to increased level of estrogen, since she is going to experience menstrual cycle every month for the respective years. She is going to late her first conception. Is that clear? So therefore early menarche, late menopause, late first conception, and obese female, because in obese female estrogen is going to be present in higher concentration, right? We all know that, right? And in any patients who are under oral contraceptive pills. Oral contraceptive pills means what? It is the contraception of choice which the patient will take in order to either delay the menstruation, right? In order to delay the pregnancy, right? So because of that reason the patient will take this oral contraceptive pills. So all these conditions, early menarche, late menopause, late first conception and obese female, because in obese females the level of estrogen is going to be high. So since the level of estrogen is going to be high in obese female, they are also at risk for developing this fibroid. And patients who are under oral contraceptive pills. What are the oral contraceptive pills? Most commonly the estrogen and the progesterone containing oral contraceptive pills. And most commonly the obese female, what is the estrogen which is going to be predominant? It is the E2. So E2 is the estrogen which is going to be more predominant in the obese female. Is that clear? Yes. And apart from that, the most important risk factor is going to be nulliparous female. Why nulliparous female is because we all know that, see, I told you, if a female is going to delay her first conception, let's say for example by around 2 years, for that 2 years she is exposed to increased estrogen because she is going to experience her menstrual cycle every month for those 2 years. But if a female is going to experience her cycle every month in her lifetime, since she is nulliparous, because what do you mean by nulliparity? Nulliparity means a female who has never experienced pregnancy. So a female who has never experienced pregnancy, it means that, let's say a female is around 22 years, so right from 12 years till 22 years she has been menstruating every single month. So since she is experiencing menstruation every single month, there is going to be exposure to estrogen and progesterone. She is not getting any break from this menstruation by pregnancy, since there is no pregnancy in her until now. So nulliparous female are at increased risk of developing fibroid, because nulliparous female, she is exposed to this estrogen for a prolonged period of time. So nulliparous female, early menarche, late menopause, late first conception and obesity. What do you mean by E2? E2 stands for estradiol. it is an estrogen. So in obese female, estradiol E2 type variant of estrogen will be increased, and patients who are taking oral contraceptive pills which contains estrogen plus progesterone. So these are the most important risk factor for the development of fibroid. But you need to remember that this condition is most commonly an asymptomatic condition. Right? So around 50% of the patients are going to be asymptomatic. Most of the patients do not have any symptoms. So in certain patients, they will develop some symptoms and they will come to you. But in certain patients, it is going to remain silent, that it is going to be around 50% of the patients, they are going to be asymptomatic with fibroid being present in them. Right. So now we have discussed what is fibroid and what are the risk factors of fibroid and with which age group it is going to be more common. Now we all know that this fibroid is a tumor. This is a benign tumor. And this fibroid is actually surrounded by a pseudocapsule. It is not a true capsule, it is a pseudocapsule. So fibroid is actually surrounded by a pseudocapsule, and in the pseudocapsule only blood supply to the fibroid is present. We all know that any tumor, if it has to grow, it needs blood supply, it needs nutrients and blood supply for its growth. So this tumor is getting its blood supply, which is located in the periphery of the tumor. So in the periphery, the pseudocapsule is present. So in the pseudocapsule, the blood vessels are present. So the blood vessels which are present in the pseudocapsule will supply the blood to the fibroid. So therefore, the fibroid will increase in size. Is that clear? So therefore, fibroid is a hormone dependent condition, that is estrogen plus progesterone dependent condition, right? And then the fibroid has a pseudocapsule. All the blood vessels will be present in the pseudocapsule, right? Since the blood vessel is present in the pseudocapsule, therefore the most vascular region is going to be the periphery of the fibroid, because only in the periphery of the fibroid the pseudocapsule is present. Since the pseudocapsule contains the blood vessels, these blood vessels supplies the fibroid. Therefore the most vascular region is going to be the periphery of the fibroid, and the least vascular is going to be the central portion of the fibroid, because in the central portion is least vascular and the peripheral portion contains all the blood supply. So the most vascular is going to be the periphery of the fibroid, and the least vascular is going to be the central portion of the fibroid. So until now we have discussed about what is fibroid. The fibroid is surrounded by a pseudocapsule, in which age group female it is more common, and the blood supply of the fibroid. Now let's discuss about the types of fibroid. So most commonly fibroid is of three types. Okay, so one is submucous fibroid. The fibroid which is present in the uterine cavity is called as submucous fibroid. Intramural fibroid, which means muscle, inside the muscle. So any fibroid which, if it located in the muscular layer of the uterus, that is the myometrium of the uterus, it is called as intramural fibroid. Any fibroid, if it is located in the outer surface of the uterus, in the serosa, it is called as subserosal fibroid. So submucous fibroid, intramural fibroid, and subserous fibroid. These are the most common three types of fibroid. But among these fibroid, which is the most common fibroid? The most common fibroid is an intramural fibroid, the fibroid which arises from the myometrium of the uterus. Is that clear? Let me show a schematic representation to you. As you can see here, this is the endometrium of the uterus. So in the endometrium of the uterus, the fibroid which is located is called the submucous fibroid. This is the myometrium of the uterus. So any fibroid which, if it arises from the myometrium of the uterus, it is called as intramural fibroid, and it is the most common fibroid. And if it is located in the outer surface of the uterus, that is the serosa, it is called as subserous fibroid. And if it has a stalk, see, it is located in this fibroid. To take this fibroid in consideration, this fibroid is located in the serosa of the uterus, so it is subserous. But also you need to note here that it has a stalk being present here. So any fibroid which develops with the stalk, it is called as pedunculated subserous fibroid. Since it is located in the serosa, it is called subserous fibroid. Since it is pedunculated, it is called as pedunculated subserous fibroid. And as you can see here, here is a fibroid which is located in the cervix. Since it is located in the cervix, it is called as cervical fibroid. Right? So we have discussed about the most common type of fibroid is going to be the intramural fibroid, and what is submucous fibroid, and what is subserous fibroid. So you need to remember these three things very commonly: submucous, intramural, subserous. The most common among these is going to be the intramural, the fibroid which arises from the myometrium of the uterus. Now comes the hero of fibroid. that is the FIGO classification. What is FIGO? Federation of International Obstetrics and Gynecology. So they have actually classified this fibroid. So the classification is given in this table. So now we are going to learn this classification with the help of this diagram. Right? Okay. So they've actually classified this fibroid into how many types? They have classified this fibroid into 8 types. Right? It is divided into 8 types. What do you mean by the first type? So it starts from 0, 1, 2, 3, 4, 5, 6, 7 and 8 is also present, right? So what is the 0? 0 means pedunculated intracavitary fibroid. So I told you anything if it is present in the uterine cavity, it is a submucous fibroid. And if it is having a stalk, it is called as pedunculated. So since it is present in the intracavitary portion of the uterus, it is a submucous fibroid. Since it has a stalk, it is called as pedunculated submucous fibroid. So it is 0. So FIGO classification 0 is pedunculated submucous fibroid. Then what is 1? 1 is that less than 50% of the fibroid is intramural. We all know that this is the intramural portion of the fibroid, right? So this is the intramural portion of the fibroid. This is the intramural portion of the fibroid. Here, as you can see here, this fibroid is occupying less than 50%. Less than 50% it is occupying the intramural portion. So type 0 is pedunculated submucous fibroid. Type 1 is less than 50% of the fibroid is occupying intramural. So more than 50% is in the cavity, less than 50% is in the intramural segment. And what is the type 2? Type 2 is exactly the opposite of type 1, where more than 50% is occupying the intramural portion and less than 50% is in the intracavitary portion. Is that clear? Can I repeat it again? So we have classified this fibroid by FIGO classification. So FIGO have actually classified this fibroid into 8 types. 0, 1, 2, 3, 4, 5, 6 and 7, 8. 0 stands for pedunculated submucous. Why it is submucous? It lies in the intracavitary portion of the uterus. Since it is intracavitary, it is submucous. Since it has a stalk, it is pedunculated submucous. What do you mean by type 1? Type 1 stands the fibroid is actually occupying less than 50% of the intramural segment. So more than 50% is in the cavity, less than 50% is in the intramural portion. That is type 1 of fibroid FIGO classification. What is type 2? Type 2 of FIGO classification is exactly opposite of the type 1, where more than 50% is intramural and less than 50% is in the intracavitary. As you can see here, more than 50% is in the intramural and less than 50% is in the cavity. So that is type 2. So submucous fibroid is of 0, 1 and 2. As you can see here, I have divided it clearly. See, submucous fibroid type 0, type 1 and type 2. Type 0 is inside the uterine cavity. Type 1 is less than 50% in the myometrium, more than 50% in the cavity. Type 2 is more than 50% in the myometrium or the intramural part and less than 50% in the cavity. Now what is type 3 and type 4? So type 3 and type 4 stands for the intramural part. So what is type 3 and type 4? Type 3 means it is intramural in location. What is intramural? This portion where you see is the intramural port. So this fibroid is located in the intramural part, but it contacts the endometrium. That is, see, this is the type 3 fibroid. It is in the intramural portion, but it touches the endometrium. As you can see here, it touches the endometrium. Since it touches the endometrium, it is intramural fibroid, but it contacts the endometrium. So it is type 3. Type 4 is, it is an intramural. It is purely an intramural fibroid. It is purely an intramural fibroid. That is type 4. So submucous fibroid is of type 0, type 1, type 2. Intramural fibroid is of type 3 and type 4. Now comes the subserous fibroid. So subserous fibroid is of 5, 6 and 7 is of subserous fibroid. So what does 5, 6 and 7 tells that? Is that subserous fibroid means the fibroid is located in the serosa. right? The outer part of the uterus in the serosa, this fibroid is located. Therefore, it is subserous. But what is phi of FIGO classification? Phi tells that more than 50% is in the intramural segment. That is phi. 6 means less than 50% is in the intramural. As you can see here more than 50% is in the intramural segment. In type 6, less than 50% is in the intramural segment. And what is type 7? Type 7 is the fibroid is present in the serosa of the uterus, but it has a stalk. Since it has a stalk, it is a pedunculated subserous fibroid, that is type 7. Is that clear? Okay. Now what is type 8? Type 8 is other types of fibroid. What are the other types of fibroid? We know that there is also cervical fibroid. The fibroid can also be present in the cervix. As you can see here, fibroid can also be present in the cervix. So if the fibroid is present in the cervix, it is type 8 of FIGO classification. So any other fibroid apart from the submucous, intramural and the subserous comes under type 8 of FIGO classification of fibroid. There is also another type of fibroid which is called as hybrid fibroid, hybrid leiomyoma. That is nothing but hybrid leiomyomas or the fibroids which extends from the endometrium of the uterus to the subserous part of the uterus. That is, we all know this is the endometrium of the uterus and this is the serous part of the uterus, serosa part of the uterus. Any fibroid which extends from the endometrium of the uterus extending till the serosa of the uterus, it is called as hybrid uterus. So whatever is lying in between these is hybrid uterus. So therefore, as you can see here, 2, 3, 4, 5 comes between these two portions, right? So because 2, 3 and 4, 5 comes between the endometrium and the serosa of the uterus, 2 to 5, type 2 to 5. So any fibroid which is occupying the endometrium to the serosa of the uterus, that is type 2 to 5, it is called as hybrid fibroid or hybrid leiomyoma. It is called as hybrid fibroid or hybrid leiomyoma. Is that clear? I hope I have made it very simple for you, right? So let's have a quick revision now. So FIGO, Federation of International Obstetrics and Gynecology, have classified fibroid into 8 types. So type 0 is pedunculated submucous fibroid. Type 1 is less than 50% is intramural. More than 50% is lying in the cavity. Type 2 is less than 50% is in the cavity and more than 50% is in the intramural portion. This is submucous, right? This is all about submucous. From type 3 is intramural but it contacts the endometrium. Type 4 is entirely intramural. This 3 and 4 is of intramural. Type 5, 6 and 7 is all subserous. 5 is more than 50% intramural. Type 6 is less than 50% intramural. Type 7 is pedunculated subserous. So this is all subserous. So anything other than submucous, intramural and subserous comes under the type 8 of FIGO classification. There is also another kind of fibroid called as hybrid fibroid, which means any fibroid which extends from the endometrium, that is the submucous, till the serosa of the uterus, that is subserous, type 2 to 5, that is called as hybrid leiomyomas or hybrid fibroids. Is that clear? Okay, so we have dealt with the FIGO classification of fibroid very easily, right? Please take a screenshot of this so that it will be very easy for you to learn, right? Okay. Now, so we have discussed about submucous, intramural and subserous fibroid. So one thing which you need to learn about submucous fibroid is that submucous fibroid is the most common fibroid to undergo malignant change. Rarely fibroid can also undergo malignant change, but it is a very rare phenomenon. But the most common fibroid among the other to undergo malignant change is a submucous fibroid. At the same time, the most common fibroid which is causing the gynecological issues such as infertility and recurrent pregnancy loss is also a submucous fibroid. So submucous fibroid is the most common fibroid to undergo malignant change, and submucous fibroid is the most common fibroid which is causing infertility and recurrent pregnancy loss. So why does it causes recurrent pregnancy loss and infertility? We all know that submucous fibroid is situated in the intracavity or the endometrium of the uterus. Since it is situated in the intracavity or the endometrium, every pregnancy has to get implanted in the endometrium. So if the fibroid is going to interfere with the implantation or interfere with the growing fetus, it is going to cause either recurrent pregnancy loss or infertility. So because of that reason, the most common fibroid to cause infertility or a recurrent pregnancy loss is the submucous fibroid, and the most common fibroid to undergo malignant change is submucous fibroid. Is that clear? Okay. So now let's deal about the other types of fibroid. The most important is going to be the cervical fibroid. So cervical fibroid, that is nothing but the fibroid situated in the cervix of the uterus. We all know that uterus. See, this is the uterus. Here we have the cervix, and here we have the vagina. So this is the uterus, this is the cervix, this is the vagina. If the fibroid is going to be present in the cervix, it is called as cervical fibroid. And this can be situated either in the anterior cervix, or it can be situated in the posterior cervix, or it can be situated in the middle line of the cervix. If it is situated in the anterior part of the cervix, what will be the symptom with which the patient is coming? If it is situated in the posterior cervix, what is the symptom? And if it is situated in the midline of the cervix, what is the symptom? So we all know in the cross section that before the uterus, bladder is present, and behind the uterus, rectum is present. So if the fibroid is situated in the anterior portion, because of the compression, this fibroid is actually going to enlarge in size, right? So because of the compression, it is going to cause symptoms with bladder. If the fibroid is situated in the posterior cervix, right, the cervix is actually present here. If it is present in the posterior part of the cervix, it is going to cause problem with the rectum. So what are the symptoms with bladder and what are the symptoms with rectum? So anterior cervical fibroid will present with symptoms of urinary retention. Since this fibroid is going to exert some kind of pressure over the bladder, it will present with symptoms of urinary retention. Is that clear? It will present with symptoms of urinary retention. If the fibroid is going to be present in the posterior cervix, it is going to put some pressure on the rectum, and the patient will present with complaints of constipation. Is that clear? Yes. So anterior cervical fibroid, patient presents with urinary retention. Posterior cervical fibroid, because of the pressure, the patient will experience constipation. Okay, so now we have discussed about anterior as well as posterior. What if the fibroid is present in the midline of the cervix? So if the fibroid is going to be situated in the midline of the cervix, and it is going to be a large cervical fibroid, it is going to enlarge. So if the size of the fibroid is going to enlarge, therefore the cervix is going to enlarge. So the proportion of the uterus to cervix is going to alter. The cervix is going to become very big in size because of the fibroid which is present in the midline, and the uterus is going to become small. So this has an appearance called as lantern on St. Paul's Cathedral. So what is a lantern? This is the lantern. So lantern on St. Paul's Cathedral. So this is going to be the cervix, which is very big. So St. Paul's Cathedral is very big, and the lantern is going to be the smallest portion, that is the uterus. So it means that comparatively between the uterus and the cervix, the proportion of cervix is going to be increased because of this large cervical fibroid which is present midline in the cervix. So it has an appearance called as lantern on St. Paul's Cathedral. This lantern is small as the uterus, and this cathedral is as large as the cervical fibroid. Is that clear? Okay. So until now we have discussed about the